Good evening. I thank you all for your patience in our delayed start. But this is, as Madam Mayor said, a most important and joyous meeting. And I am certainly glad to be a part. I'm also glad to have been given the honor of reading this proclamation declaring the May as Mental Health Awareness Month. A couple of points, and then I will begin reading the proclamation. Again, as you all know, my day job, I work as a pediatrician, and many of our kids are suffering and have suffered in the context of the pandemic, even prior to, in terms of their mental health. So do make sure that you're checking in on your kids. For those who are interested in helping, the Maryland Medical Reserve Corps, the folks that help with volunteering with regard to the pandemic, actually is hosting training for mental health toolkit for people who want to work with youth. So that's happening. You can just check out their website. You don't have to have a medical background to volunteer on that. If you or someone you know is in the throes of mental health crisis, do know that the 988 number is out there. It's like 911 for a mental health emergency, and certainly encourage you to take part of that. And as you know, the city's having active discussions about a restitution center here in city limits. So with that, I'll begin reading this most important proclamation. Whereas in May 1949, Mental Health Awareness Month was established by Mental Health America to encourage people to consider their mental health as important for overall health. And whereas data shows that rates of anxiety, depression, and suicidal ideation have increased for all Americans, and in the last 2 years, a higher number of children, youth, and adults have sought mental health treatment for stressors such as trauma, anxiety, depression, isolation, bullying, food insecurity, and financial hardship, and have often faced barriers to accessing treatment due to availability of clinicians, language, transportation, copays, and deductibles. And whereas stigma and fear of discrimination keep many who would benefit from mental health services from seeking help. And research shows that an effective way to reduce stigma is through personal contact with someone with a behavioral health condition. And whereas the City of Rockville, Maryland recently hired a mental health specialist, Ms. Beth Loftus. And whereas the City of Rockville Department of Housing and Community Development reaches out to Rockville residents about mental health, wellness, and substance use prevention with educational seminars, as well as emergency assistance and information and referral services to support their striving for success in home, school, and community. And whereas the City of Rockville Department of Housing and Community Development collaborates with MCPS, Montgomery County Department of Health and Human Services, and local human service providers on school year and summer programming for children and youth, such as therapeutic recreation, mentoring, Latina youth development, mental health counseling, and transitioning to middle and high school. And now, therefore, the Mayor and Council of Rockville, Maryland, do hereby proclaim May 2023 as Mental Health Awareness Month and encourage the Rockville community to remember that mental health is health and to seek help if needed and adapt to significant changes. With that, Madam Mayor, I move the proclamation.
Motion's been made and seconded. All those in favor, please